It's time for another new Kansas City Spotlight. Here's your host, Lauren Scott.
Millions in the U.S. live with diabetes and diabetic nerve pain, causing daily numbing, tingling, or burning sensations. But there is now a new treatment to help. I'm Lauren Scott, your host for Kansas City Spotlight, and today I'm joined by neurosurgeon Dr. Ericka Petersen and one of her diabetes patients, Cagle. Thanks, guys, for joining.
Thanks for having us.
Yes, sir. Thank you.
Dr. Petersen, can you tell us more about diabetic nerve pain?
So painful diabetic neuropathy is a condition where, because of chronic elevated blood sugar levels, there's nerve damage, and that damaged nerves then are numb, they're painful, there's burning, there's pins and needles, there's painful cold, itching sensations, all of those, and it affects predominantly the legs and the feet. We know there's probably about 33 million diabetics in the US currently, 88 million people who are pre-diabetic, but of the people with diabetes, about 8 million have painful diabetic neuropathy symptoms. And they may have tried medications, but a lot of medicines don't work or have side effects that ultimately make the treatment of this sort of burning, painful numbness very difficult for them to manage.
Tell me how this treatment works exactly.
So the HFX for PDN device is a small implanted battery pack. You think of it sort of like a pacemaker for pain. The battery pack has a little computer in it, and there are wires that go into the spinal canal from that unit that then delivers an impulse into the spinal nerves, which then helps to reduce or block the pain messages that are traveling from the nerve damage in the feet and register up in the brain. So you're able to, without a medication, in a non-drug way, modify how pain messages are transmitted in a way that can significantly improve somebody's ability to function and even get sleep.
Lee, I want to come over to you. How has this illness affected you?
It was miserable. I mean, my legs and feet hurt all the time. I couldn't get any rest. I built a tent over the foot of my bed just to keep the sheets off of my lower extremities, just so that I could get some decent rest before I had to get up and go back to work standing on my feet and being miserable all day long.
All right, so how has this new treatment helped you, and would you recommend it to others?
It's like night and day. I'm a lot more personable. My apprentices enjoy being around me again. It's like a godsend. This piece of device right here. I mean, I thought I was without hope prior to hearing about this device, and now I've been spreading the news about this to several people waiting for the FDA approval, and now that it has it, I'm going to be letting them know that they need to start getting in line.
Okay, so where can people go if they want to learn more?
Go to hfxforpdn.com.
Thank you both so much for being here today.
Thank you.
Thank you.
This Kansas City Spotlight has been paid for by the Nervo Corporation.